everyone. It's great to be with you. I am Allison O'Toole, the very proud CEO of Second Harvest Heartland. Hunger is surging in my South Minneapolis neighborhood and in so many other communities in the Twin Cities. Grocery stores were destroyed in the uprising that followed the killing of George Floyd. Jobs were lost. Hunger is getting in the way of our work to rebuild. It is complicating efforts to build a stronger, more equitable community and to effectively fight COVID-19. At Second Harvest Heartland, we stand with our neighbors seeking justice and equity. We will work around the clock to ensure everyone is fed now during the hard work of rebuilding, but that's not enough. We need to look at and fix the stark racial disparities in who is hungry. Black and Indigenous families in our community are at least twice as likely to live with hunger compared to their white counterparts. It is unacceptable that anyone's ability to feed their kids is dependent upon zip code or race. I'm joined this morning by three tireless change makers who are lighting the path for the hunger relief community. Shaun Sherman of the Sioux Chef, Louise Matson of the Division of Indian Work, and Kimberly Spates of NorthPoint Health and Wellness Center. Thank you so much for joining us this morning. Shaun, Louise, and Kimberly, I have heard so many people comment on what's changed in our Minneapolis neighborhoods. It's hard to reconcile the streets that we all know with the blocks of burned out buildings that we all now see. Our neighbors can't accept the miles of cars lined up waiting for free groceries, and that could be a reality in Minnesota, and I understand their shock. But I also see neighbors standing with other neighbors, a spirit that is as familiar as any landmark we've lost. I see a desire to come through these difficult times with stronger ties and a new commitment to do better for one another. I see and share a desire to learn more about what community-led rebuilding should look like. Second Harvest Heartland is following the lead of neighborhood and community organizations like Shaun, Louise, and Kimberly's to ensure everyone is fed and fueled for the work ahead. We quickly joined forces with local hunger relief organizations and the city of Minneapolis to coordinate a large-scale food distribution serving nearly 1,000 families in Powderhorn Park. We made 9 emergency deliveries of baby formula, diapers, and food to neighborhood food shelves. Minnesota Central Kitchen teams delivered 500 hot meals to the Little Earth community last weekend. And Kimberly, I know you have been at least this busy. I will hand it off to you. Please tell us a little bit about how your team has mobilized to help the community.
Thank you so much, Allison, and good morning, Minnesota. We appreciate the opportunity to be here to talk about our work over in North Minneapolis. And for those who might not know, NorthPoint, which was formerly Pilot City, was actually formed out of the 1967 riots over in North Minneapolis that decimated the Black and Brown and Jewish community at that time. And so we're just happy and honored to still be here, serving the community for over 50 years and providing much needed basic needs. Our biggest and most used service outside of our medical, dental, and behavioral health services is our food shelf. We've had to move to a smaller location due to our new building being built, starting in 2021. And so we had to make some changes on how we deliver services. I'm extremely proud of the staff and volunteers that work there. We've made some changes due to COVID and have redeployed staff there from other parts of our organization who mask up, glove up Monday through Friday to help provide support to the food shelf. And in the wake of Mr. Floyd's death a few weeks ago, we have been asked to take in a lot more donations. And so we've had to have all hands on deck. I even volunteered one day to clean out our mobile food truck, which was full to the top. So that was a little workout, but I didn't mind. We're able to provide food when necessary. We're a little bit off of Broadway that sustained most of the damage. And so we've been trying to just be here to supply food to those who might need it, other drop-ins or pop-ups, other food distribution sites that might need food because we've been getting so much. And we've seen a kind of a downtick in individuals coming. And so at the end, I'll have an ask about for the news outlets to kind of help get the word out that we do have food and people can come. But for the most part, our job has been to make sure that we continue to provide the services that need to be provided so people have access to COVID testing. Here we have a driver testing center that we put up. It's been probably about a month now. Our staff at the clinic have continued to provide services as they are able. And for food access, we know that food is medicine. And so we try our best to continue to provide what we can provide, even with the fresh fruits. We had to suspend our choice system because we went to pre-boxing. People don't necessarily like that. So there's a lot of hustling and bustling outside the front doors. I don't want this, do you have that? So we try to negotiate, but on Tuesdays and Thursdays, when we do have our fresh produce, we are still able to provide some choice for individuals. We have a parking lot area that we utilize and keep people 6 feet apart, you know, try to maintain all the COVID guidelines as we provide that service. And our hope is that individuals know and feel comfortable coming and getting food if they need it. We try to provide it in a way that's honoring them as individuals and providing culturally specific foods when we can. But I think for us, our rebuilding effort is to just be here because we know that as time goes on, the pop-ups are not going to be able to be sustained over time. And so for us as an institution that's been here for 50 years, we continue to be here, we're open, and we try our best to respond when we're called upon. And we hope that we can continue to build some relationships through these conversations to find places where we might be of assistance. One place that we've seen an uptick in use is in our mobile food shelf that provides food to our senior high rises in our area. So we've seen an uptick in individuals utilizing that service, and we hope that that will continue to grow because as we know, that's a vulnerable population that doesn't need to get out. And so if we can bring the food to them, we'll continue to do that. But my hope is through these conversations that we'll continue to provide access to food in whatever way necessary. And NorthPoint is always available to partner. That's our mission, partnering to create a healthier community. And so we're happy to have been here today to provide some information and partner with others. So I'm really looking forward to hearing from Louise from DIW. So Louise.
Bonjour, Louise Matson, Indigenous Makwan Dudam Gawa Baba Kini Kagan Dunjaba. My name is Louise Matson. I'm Bear Clan from the White Earth Nation. I'm also the executive director here at the Division of Indian Work. We're located on Lake Street between 10th and 11th. We have been around since 1952, and we've been in this current location for about 25 years. We do a variety of services here at DIW, from youth programs to counseling, home visiting. We have a foster care home. So we have a lot of other programming here, but our very first program and a very important program that we have is Horizons Unlimited, which is our food shelf. And so of course for us, you know, we're in the heart of the Native community in Minneapolis, in the borderline of the Phillips and Powderhorn community. And we're also, you know, we've always been in the middle of this kind of food desert, and really challenging for our community members to get healthier foods. And we too, similar to like Kimberly was mentioning, we've tried, you know, doing things like choice model. We've partnered with folks to get vegetables, but it, you know, it's just challenging. It always has been challenging for our community to get fresh vegetables and healthier food and culturally specific food. A lot of our culturally specific food is a little more expensive for us to purchase, like wild rice or things like that. So, so that's been a challenge in our community for a long time, and we struggle with those impacts of higher rates of diabetes and obesity. but I'm very proud to say there have been a lot of work being done, like Shaun Sherman and the Indigenous Food Network, things like this that have been around now for a few years, really pushing back for healthier food, less processed food, more of our traditional food. So that's something that's been going on and gaining momentum. But of course, then two things happened. COVID hit, and that already impacted our food shelf. We had to go to a drive-up method. So right now, we're open for folks to come in and pull up in their cars, and it's out of our garage bays. So we're making that work right now. And then when we had the destruction on Lake Street, we were closed for about a week, and then we reopened and are trying to serve the community. We also partnered then with folks at NACD, at All Nations Church, at the Indian Center on these pop-up food shelves, because for a couple reasons. It was hard to get here. So on 10th and Lake Street, a lot of Lake Street was getting closed off and everything. And then I think people were also afraid to come here. Our community members are staying home. So we were bringing food to these pop-up food shelves, like at Little Earth Residents Association, again, over at Powwow Gallery. Also for community members that were here protecting our building in the evening during the worst of the destruction on Lake Street. So we were bringing food to them as they were preparing in the evening to go out and scatter in the community and protect our buildings, which they did. DIW survived with just some graffiti damage. Otherwise, we're still open. So again, like Kimberly was saying, getting the word out. We're open, folks. You can come here. It's safe to come here. The buses are running now. We've got a lot of food. And you know, I've just been so amazed and touched by the hundreds and hundreds of people that have dropped food off here, that have dropped off toiletries, Pampers, tampons, you know, everything that you could need. And then, I mean, hundreds of people offering to help. And in fact, we hired a donations coordinator, or I should say I did, to help us in the community coordinator. I see on the call, we have Joe Walker, who's been amazing, coordinate to continue operating these pop-up food shelves, continue to, all the people that want to help, how do we reach out to them and say, hey, we need volunteers to unpack this food over at All Nations, because it's Marlene over there. It's one person. They don't have a lot of staff. You know, we've been closed. And even for me, just being up here checking in the building and people are coming through the doors, it's just been amazing, but we need to coordinate it. We also want to capture those people who want to help for the long term, because right now we have had an outpouring of generosity. I'm so appreciative, but I'm looking at the fall. I'm looking at what happens when we can't give food out through our garage door bays, when some of these pop-up food shelves are going to close down, because that really isn't, they're not set up to be food shelves, and they need to do the business of their agencies or their church. So wherever they might be, and we will continue to do them, but you know, we'll be open. We'll be here. We've added more hours. I've increased my food shelf staff person. But we're going to have to look at, with COVID in the fall, maybe doing home deliveries. We cannot have people, we cannot have elders in our lobby. It's not big enough for social distancing. And I guess just touching on looking at, so we lost Target on Lake Street, we lost the Cub, we lost the Family Dollar store right next to us. So not only is that our neighborhood grocery store, that employed a lot of our community members, those places. And additionally, like Cub and Target were extremely generous supporters of us. We would get rescue food 3 days a week from Cub and also from Target. And a lot of that stuff was the fresh stuff. That was the you know, the lettuce and the things like that we don't have access to anymore. And I think the Target will be back at the end of the year. I haven't heard about the Cub. So those impact our community on so many different levels. How about getting prescriptions and things like this? One thing, so we don't need to rebuild DIW, we need to rebuild our community. And I've been on some calls where I do think this is an opportunity to also address our homelessness issue that we have. Some of the places like Family Dollar Store, is that coming back across the street for me? Because if it's not, that would be an awesome place for like a tiny community or a home for maybe elders that are raising their kids right across the street from DIW that has all these services that they could access. And I just say that, not that I don't want Family Dollar Store to come back, but just a block away is the lot where Robert's Shoe Store was. When that burned down several years ago, it has not been rebuilt. And so to me, all these mom and pop businesses too, I'm really hoping they come back. But if people are not going to be able to come back, how can we use that space to serve our communities? That, you know, we have an issue with affordable housing and different kinds of support models in Minneapolis. It's an ongoing issue, and so this could be an opportunity to use some of this space to do housing like that. And there are experts in our community that know how to do it and that have done similar housing. So I'm not sure how much time I have left. I feel like I'm dreaming of talking, but you know, again, I think and our strength in our community in Minneapolis, Native and non-Native, is people helping and partnering. But I will say in our Native community here, you know, we do a good job of supporting each other. We have our Metropolitan Urban Indian Directors Group. We have Indigenous Food Network. We have a lot of community supporting each other, and that's where the greatest ideas come on how to move forward, is that creative and that will to help people, and how can we do it better in partnership. So
great. Louise, thank you so much. It is amazing when pressed how creative and open our minds can get, and that is very good to encouraging news. But thank you so much for everything you're doing. So we'll move on here to our last speaker, and I think Southsiders can also expect more amazing things from Shaun. A just-in-time partnership with Midtown Global Market and the Sioux Chef will enable Minnesota Central Kitchen to distribute even more hot meals in South Minneapolis. Shaun, welcome to the Minnesota Central Kitchen family. We are so honored and delighted to have you and to work alongside you. And welcome to the conversation. I'll just pass it to you.
Thank you. And Hihani Washte, my name is Shaun Sherman. We own the company here, the Sioux Chef. We're cooking out of Midtown Global Market. And, you know, over these past crazy few months in Minneapolis, and especially the past few weeks, we really wanted to mobilize and help make a difference with what we do. You know, our focus has always been bringing awareness to Indigenous foods and creating access to it. But now is the time, even more importantly, to have this access in our communities. So we are starting to, you know, we're really excited with this partnership with Minnesota Central Kitchen and Second Harvest to be able to push out up to 400 meals a day to start with, and we can see how it goes. And, you know, we're really excited to be doing what we do, which is exactly just creating healthy Indigenous foods, you know, and we kind of unapologetically create only healthy foods that are beautiful and taste good, and it's from our local producers. So we get to support our local growers at the same time as getting healthy food out to the community. And we're building a really wonderful, skilled team to help us pull this off. And we're just excited for all the possibilities. Originally, we were going to be opening up our first restaurant right now at this time period, right before COVID hit. We had to put the brakes on and wait it out, but we're still moving forward with being able to get food out where it needs to continue to work on our educational programming, to teach people about healthy foods and our Indigenous histories and the land that we're on, and all the opportunities that we have to look at our land space differently, to look at how we feed our communities differently, and to really put a lot of effort into supporting our local growers and feeding the people that really need it the most. So I just want to thank you guys for having us as part of this effort, and we're looking forward to everything that we can contribute.
There we are. Thank you so much, Shaun, and just amazing work by everyone. It is so good to be with all of you and to hear just straight from you all what you need and what's happening. And thanks for diving in with us this morning. You know, really this response is just getting started. This week, we will at Second Harvest Heartland begin 3 weekly food distributions, emergency grocery pop-ups to meet the growing need in the Twin Cities neighborhoods. And we'll keep these weekly infusions of food as long as the need is there. We stand alongside all of you and our community in making sure we get this and we fight this virus and rebuild as a community, and we're fed along the way. And we're going to keep at it. You'll see on the screen our progress so far at keeping hunger at bay. We've been in high gear and we're going to need to keep it up. So looking ahead, our teams are gearing up for historic increases in need as the strain on the economy intensifies, especially this fall. We're facing down big challenges and it can be daunting. But here's the truth. If we can meet the huge community need coming our way this summer, and together we can, I know it, we can also do better for one another in calmer times. And the pandemic has made clear to many of us that our collective health and well-being are interconnected. The choices we make today can honor that new, hard-earned understanding that brings us closer together. So I'm going to kick it back to Louise, Shaun, and Kimberly to answer one question, and then I think Elizabeth will help us dive into whatever else is coming in online. But Louise, Shaun, and Kimberly, how can community members get help, and how can they give help to support your efforts now and in the long term when it's so needed?
So yeah, thank you for, oh, you want to start with Shaun?
Nope, go ahead. Nope, Kimberly, go for it.
I'm sorry.
Dive in.
So yeah, from NorthPoint's perspective, we want to make sure that individuals know where we are. Our food truck is at 1835 Penn Avenue North. It's on the corner of Penn and Golden Valley Road. We're open Monday through Thursday, 10 to 4 p.m. We also want to make sure that people know that we are providing SNAP and menstrual support at our main clinic, which is open from 10 to 5 p.m. at 1313 Penn Avenue North. And I think the things that I would ask, especially from our news folks, is to let people know that these services are available and out there for them, and to destigmatize the use of a food shelf. If you're hungry or you need something, you need to show up. And if you're in North Minneapolis, NorthPoint is probably one of the only large food shelves that come with all the other services. And so as you're talking and doing all the nice things that you do on the news every night, just make sure that people know that if you need food, you can get it. There's a lot of places in the Twin Cities and outstate that you can get food and not feel like because I lost my job to COVID and I've never had to use a food shelf before, or I never had to ask, that you can't ask. You should, because we're here for that. And that those who want to give, we're taking financial donations through northpointhealth.org/donate. And if you have any questions, you can always call 612-767-9500, 9500, and we'll be able to route you anywhere you would like to go. We hope to be able to bring volunteers back in July when we start to do our Fresh Food Fridays, our produce distributions, and then, you know, trying to monitor and manage the COVID symptoms and regulations and things like that. But our real hope is that we can tell people where we are and that we're here and we're available and we're not going anywhere. And if you need something, all you gotta do is call, show up, and we'll make sure you get to where you need to. But thank you so much for the time today.
Thanks, Kimberly. Louise, would you like to go next?
Yes. So I think our food shelf continues to be open Monday, Tuesday, Wednesday, and Friday, noon to 3. But I do urge people to call before they come, just because one thing I didn't mention before is, I mean, I'm not sure what the construction is going to be like on Lake Street and accessibility. But right now, that's our model that we're using, open for pull-up pre-packed bags. And but I would call 612-722-8722, and that's our main line. And we do check the messages throughout the day. You know, we've been closed to the public, but our receptionist, who's an elder, checks those calls from her home. If you want to donate, diw-mn.org for financial donations. Also, if you want to donate your time and maybe some elbow grease, please email hsmith@diw-mn.org. He's the person that we hired to help not just at DIW, but at these various pop-ups, how people want to help. Like if they just want to help, like I said, unload things, sort things, bag them. And also you can support Second Harvest Heartland or the food group or Hunger Solutions, all these organizations that help us. That's another way, but those are multiple ways to help. And I'm just so grateful for everybody that has nameless, countless people that just showed up here and helped us. I'm very grateful. Chi miigwech.
And Louise, maybe I can ask you a question too, because I think this has been top of mind for many of us. You're getting such an outpouring of support right now. You really need it for the long haul too, right?
Yes. I think part of the issue is we're looking at the fall and what's going to happen. COVID's not going away, and we can't have people in our lobby in our building waiting for food. It's not safe. They can't socially distance. It's not safe for our elders. It's not safe for our staff. So we're probably going to have to look at either by appointments or drop-offs, and that's a capacity issue. Not just for people to do it, but that's part of the challenge too. A lot of us here, we're a small organization, and for, again, I hired somebody, I thought we'll figure out how to pay for it later because I can't respond or do that and then try to do the regular business of DIW, getting, payroll done or things like that we have to do to keep the business running. Yes, in the fall, I'm concerned about how any food shelf is going to operate in the fall, especially if we see another surge. And how that looks is we need help with that. So again, yes, right now we do have a lot of support right now, but what does it look like in the fall and the end of the year and even in January 2012?
Yeah, thank you, Louise. We need everyone to stick with us.
Yep.
Shaun, we'll pass it to you next.
Okay. Well, we put together a calling for some volunteers to help us pack the food, and we had a really great response to that. So we're excited to start working. And if people are interested, they can always find us on our social media and find some of the posts there. People can always support us through our nonprofit, which is called NATIFS, natifs.org, and it's an acronym for North American Traditional Indigenous Food Systems. As we get ready to open up our very first educational culinary training center here in Minneapolis called Indigenous Food Lab. And we're moving as fast as we can to get this open because we feel like it's a really important time to help train youth, especially people of color and Indigenous especially, and really create a new wave of people who can process foods and to get healthy foods into our community and really support our local growers. So. But again, we're just really excited to be a part of this. So there's a lot of places you can support, and that's what we need. We need people to chip in, and we need our community to come together and help us all out.
Mm-hmm. Thanks, Shaun. Elizabeth, I think we'll take some questions from our viewers, including media.
Yes, perfect. All right, we're having some great questions coming in here, and the first one is for you, Shaun. Ginny and Albert Lee, who's joining us via Facebook, is wondering how I can teach my Native kids about Native dishes and cooking. She says she serves too much mac and cheese.
That's an easy one because we put out a beautiful cookbook. Beth Dooley and I released the Sioux Chef's Indigenous Kitchen, which you can find at your local bookstores. You can find it online too. It's got over 100 recipes using only Indigenous ingredients, cutting out things like dairy and flour and sugar. So everything's extremely healthy and local and beautiful and very timely. So look for that online.
That's great. That's great. Thanks for the question, Ginny. Next, we have one for you, Kimberly. You talked a little bit about destigmatizing the use of food shelves, and we have Lionel asking how we can destigmatize the use of food shelves, how he can feel better. He still feels very shy about using his neighborhood food shelf.
Okay. Yeah, that's a good question. I think I would try to say to people, put it in the mind that you're going to Cub, Hy-Vee, Lunds, and Byerly's. It's the same thing, right? You're going you need to get food. Most of the folks who work in food shelves are just like anybody else. Some of our folks utilize our food shelf as well. So I think it's just about saying to yourself, this is just like going to the grocery store, and I'm going to pick up the food that I need for my family for this week. When folks come to us, we ask a few questions, simple questions, not anything evasive. We don't ask for ID or anything like that. And you know, it's pre-boxed now, so you're outside 6 feet away, hopefully, from the next person, and you're giving your box and you're on your way. We provide that food on a monthly basis, so you get a lot of food. But there are other churches in the North Minneapolis area and all over Minneapolis that provide the service. Some provide drive up, and you don't have to provide anything but your name and your zip code. So it's not evasive, and I think we know, and we're seeing that the impact of COVID and on the economic structures in our communities is going to be great. And so we understand that we're going to see a different population of people. And then at the end of the day, we're all humans, and we all need something at some point in time. And we just need to be able to step out on some faith and say, yep, I'm going. And even if you don't have a good experience, my hope is that you let that food shelf manager know that you didn't have any good experience, so that can be adjusted and talked about as well. But people shouldn't be afraid to come, because we're all here to serve. And you're just like my brother, sister, or anybody else. So I'm hopeful that we can continue to just say this is not anything out of the ordinary. It's just like going to the grocery store, and you should just come.
Thanks, Kimberly. That's just great advice. A question from Katie in Prior Lake for Allison. And I would love to kick it off to the other panelists as well after we hear from Allison. Is there anything we can learn from protests and natural disasters of the past to get more food to people quickly?
Oh, I think, thank you, Katie. Great question. And I will defer to my partners on this call for specifics, but I'll tell you the team at Second Harvest Heartland is learning and adjusting every single minute of every single day here to meet this need. And as you know, when it was just a COVID in a pandemic, we were stepping up to help food shelves, you know, support the food shelves and pre-packing boxes so it's safer to pick up, and really supporting our partners in doing the work more safely for their staffs and community. I think we have learned over decades from every, you know, other natural disasters, tornadoes, et cetera, that we need to really move quickly. And it's almost, Katie, a mindset for us about staying nimble and flexible and open-minded and making sure we keep our eye on the most vulnerable populations, the people who need it the most, and making sure we are reaching those folks when we really need it. This whole community will survive and thrive again if we stick together and make sure everyone has the food they need to get through it. But again, we are problem solving not only in our operations here at Second Harvest, like we do in a lot of different situations, but also supporting our partners who, you know, like Kimberly and Louise, who are the front lines, and then Shaun through Minnesota Central Kitchen. We saw a need for more prepared meals for folks, especially during the uprising. People really needed a quick infusion of food, even a hot meal or a room temperature meal, whatever it was. And we jumped into action. We're just so thankful for our partners. But I really kick it to the others on the call to talk about specifically what they're doing. We learn every step of the way, Katie, and we'll continue to.
Well, I think for us, I'll just jump in, is I think we want to get back to, serving the community, but we want to be better than we have been before, and have better food and healthier, fresh food. So that's why it's exciting to see the work that like Shaun is doing and partnering more with changing the way our food shelf is down the line. But one thing I think that we've learned is the value of being able to mobilize the food shelf and doing these pop-up food shelves and bringing food to people, because again, like I mentioned, people could not get here. And frankly, I don't know that you would want, when things were on fire in the morning, driving down Lake Street, and we have to bring it to the people. And like you mentioned, Allison, you know, right now too, if people are still sheltering and should be sheltering for longer, like our elders. So things like what, like, again, like what Shaun is doing, what can we do? How can we continue that? Because sometimes it just is difficult, to, especially if you don't have a car, to get to the food shelf, to, you know, lug your groceries all over. So I like the idea, and this will kind of spur us on, of doing food shelf pop-ups more regularly. And then, you know, we've always tried to get funding for, you know, a refrigerated truck and food shelves that could regularly, like, go to the Indian Center and do some refrigerated produce right out of the parking lot on a regular basis. So we're learning from that. And I like that. I think going to the people, right, more to the community, especially if you have something going on in your neighborhood that makes it not easy or safe to get there.
Great. Thanks so much, Louise and Allison. We have another question from Dan Gunderson. Hey, Dan, for Allison. He wants to know if donations are matching anticipated demand. How does the expected need compare with typical demand?
So thanks, Dan, for joining us. And we are seeing and hearing reports of double and triple the need right now in the early summer months. This community has stepped up like no other time to help support all of our efforts. And that's part of the reason why we're all on the call today, to highlight all of these efforts. But I'll tell you, we need this community to keep surrounding us with this support. We also need local government and state government, federal government, all levels, to step up and do their part as well. We are at Second Harvest Heartland seeing just an enormous need mid to late summer coming our way. We will share that information as soon as we have it. Elizabeth, I hope maybe next week even. We're gathering as much data as we can, but I am, you know, there have been so many dark days, Dan, and you have to cling to those bright spots. And the bright spots for me are not only conversations like this, when organizations are coming together to problem solve, and I think problem solve for the long term, but it's the way this community has stepped up to financially support or support in other ways by volunteering or giving generous donations to food shelves. That is heartening, and I just can't reinforce the fact that we are in this for the long term. We stand by this community in the long term. This is a marathon, not a sprint, as they say, and so we just need that support to keep coming our way. We will keep using our voice to elevate the voice of others as well, to make sure that you have the information you need to help us as well, and just appreciate whatever you do to help us put, you know, food insecurity front and center for this community. It is so interconnected with everything else going on, and we are really, it's our mission to end hunger with all of these wonderful partners in this community.
Thanks, Allison, and thanks, Dan, for the really good question. Allison's 100% right. We are working really hard right now to put some specific numbers to the anticipated need, and look for an invite soon, Dan, to come to another community conversation where we're going to roll all that out and go much deeper into the demand that's in front of us, the gap we see in getting there, and how we can fill that gap. We have another question for the whole panel. What are the most in-demand food items? If we were to donate, what items do you need the most? And that's from Sarah Friedman.
Well, I know for us, we need rice. That's one of the things that we haven't been able to keep sourced. Also, I think household items are essential as well. And I thought I had a long list from my staff people, but I think the other thing that, it's not as long as I thought it was. I think the other thing is the access to fresh food is going to be a little dicey for us over here in North Minneapolis. Our Cub is gone. That's one of the largest ones over here, one of the only ones accessible to individuals. And so our ability to get food rescue has been limited and has been cut in half. So the ability to support, as Louise said, Second Harvest and the food group in sourcing fresh fruits and vegetables for us will be something that we'll need to monitor and watch over the next few months, because that's going to be something that's going to be hard for us to maintain. But again, I will say that if people want to give financially, that helps us a lot, because our partners at the Food Group and Second Harvest and Hunger Solutions provides us those options at a lower price. But the biggest thing that I've seen is rice and household product system.
Thanks, Kimberly.
Mm-hmm.
Others?
Well, so yeah, produce and fresh produce and how that works. And again, and I think partnering with not just the food banks, but also some of our local growers like Dream of Wild Health and some of the other community gardens is going to, and St. Luke's church, some of these growers, it's just how do we get it out quickly and safely? That's the challenge. But I would say we need cleaning products. We've got a lot of diapers, and we have a lot of people doing diaper drives, but cleaning products. And then also one thing I've heard from people saying is coffee, because that's not something we normally would give out in the food shelf, but because especially like our elders aren't able to go to their congregate dining and they would like to have some coffee. And potatoes, I heard. Also, I can get a better list posted, because that's one thing that we had our the donations coordinator do a survey of all these pop-ups on what kind of things that we weren't giving that people were asking for. But yeah, a lot of it, and oh yeah, meat and eggs, and you know, all those kind of perishables that are harder to get out, similar to produce.
Great. So folks can act on what you've just shared, and then it sounds like checking websites would be another good strategy to get up to the minute news on the need.
Mm-hmm.
Perfect. Anything to add to that question, Shaun or Allison?
I just completely agree with Louise and Kimberly. I think people should really support trying to donate healthier options when it comes to it, if it's possible, but really supporting those efforts to feed the communities in North and South here. There's so, you know, and our group is a little bit different because we're just cooking and we're going to be training a lot of people. And, you know, if there's especially Indigenous youth in the city or people of color that want to come and work with us, you know, please reach out to us, because we're hoping to hire a lot of people and train a lot of people on healthy foods.
Okay.
That's great. And Elizabeth, the only thing I'll say is that Second Harvest Heartland is committed to providing as much healthy, fresh, beautiful produce as we can find and get our hands on. Our sourcing team is working around the clock to help do that. So I know that we are trying to desperately source some of those really needed dry items too. We've been nimble in that we've been trying to provide some of the hygiene items and other things as well. But boy, it's almost produce season, and we're going to take advantage of that, you guys, and really, really focus there, but also focus on it year round too. We can source from across the country. So we stand by you in that commitment.
Absolutely. So look for more of those emergency farmers markets in the weeks to come, it sounds like. All right, folks, well, what a wonderful conversation. I'm so grateful for the time and for our panelists and for the reporters and for the community members who joined us. That brings us to the end of our questions. And thank you again for the great conversation. Goodbye, everybody. Thank you.
Thanks, everyone.
Bye.
Bye-bye.